Good evening, everyone, and welcome to this evening's Doctors of BC webinar, Building and Leading High-Impact Teams with presenters Dr. Tom Lloyd and Dr. Don Martin. You may remember them from our previous sessions early in spring on self-awareness and relational awareness for personal growth. If not, that's all right. The recorded session can be revisited under our Business Corner on Doctors of BC website. I'm Walter with Physician Business Services, and I'll get us started with housekeeping while folks log into the webinar. I'm speaking to you tonight from Richmond and would like to acknowledge the land on which I reside on is the unceded territories of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I know we're all from various locations around or outside BC, so thank you all for taking the time to be here and the land which you're presented on tonight. So this session is on Zoom webinar format. Everyone is muted on entry. The recording will be shared on Business Corner after the event sometime next week. Please use the chat for technical difficulties and reserve all your questions to the Q&A function so it is not missed. We'll be having a few interactions through Slido. If you're not able to log on to Slido, you can always leave your comments in the chat as well. And as per all webinar sessions, a poll survey will pop up as you exit and also be emailed to your registered email address. Although optional, we'd always appreciate anyone that completes the survey. So tonight we're covering on building and leading teams. This is actually a kickoff event to next year's series. We're planning 4 sessions for next year, building on tonight's session. And Doctors Martin and Lloyd will give you a brief preview on topics at the end of the webinar. And the registrations for next year's are not available yet, but I'll make a note to email the attendees here tonight once the series is live and available for registration. I'll now pass it on to our presenters for their intro and go over today's topic. On to you, Don.
Okay, thanks, Walter. I'm going to lead off, and just to give you a sense of my background, especially since we're talking about teams, I started out in nursing and then moved into social work and then moved into working with physicians. And I've been working with physicians for close to 35 years now, either with physicians who are struggling in communication professionalism, or working with leaders who want to enhance their skills, or more recently in the last few years with teams. Over to you, Tom.
Thank you, Dawn, and hello, everybody, and hello to those that we've met before. So I'm Tom Lloyd. My background, as you can tell now, I'm from the UK originally. I trained in general surgery. I worked at MPS, which is like the CMPA in the UK, and got into and spent a lot of time with what was called the disruptive physician at that point, representing them through the NHS. Has spent time at CMPA as an advisor and then latterly at SAGES. And I think that was interesting because setting up courses around teams and culture, having spent a lot of time with the individual, and speaking to Dawn, we both feel this, is that it's interesting. We spend a lot of time with the individual, but the context is equally as important. And it's really hard to do. You know, sometimes it's kind of hard for organizations to kind of manage this. And so this is where we've become interested in teams and working together, because sometimes you have to work together on dealing with dysfunctional or or teams that want to get better. Actually, really, I wouldn't. Sometimes it's not dysfunctional; it's just teams that want to work better. So there we are. That's kind of our background. So between us, we've got quite a few years of doing this, and really, this series of webinars is our, what we say is our opportunity to kind of pass on what we're seeing as trends, what we're seeing as things that we've noticed, and to give you some ideas and some tips and some things that you can do. This work is tricky, right? Teams are tricky, and some of you will be leaders, in which case you have a lot more influence, and some of you are parts of, well, you're all parts of teams. And it may, some of this becomes a little harder for you to do as well, but there are still things that can be done. And so as we go through this, I want you to just kind of reflect on your own teams and think about, what could you do here? You're probably members of many different teams. We'll dig into that in a minute. What can you do? And please put, as stuff comes up, put it in the chat. We'll try and address it as we go along. We will have a little bit of time at the end, hopefully, if we don't chit-chat too much, to pick up any other last questions. And we also have, many of you have sent in questions with your registration, which is great too. And I think we're going to address a chunk of them. Certainly we'll address them all as we go through the series into next year. All right, let's get going. So, our agenda today, this is our first of five, a series of five, and I think that what we're wanting to do here is think about, recognize that we are part of a team to start with. And that may be obvious to some, but we're going to dig into that a little bit too, because it's something that we see as a bit of an issue at times. We want to think about how we set things up for success. And I think something that we've both noticed is that traditionally in medical teams, in all of its glory, we kind of throw people together and expect things just to happen. And it does. I mean, some good stuff occurs, but equally not without some issues and heartache and pain. And I think that the one thing that we're going to be talking a lot today about is what can we do proactively to set up the team for success? So how do we think about what our purpose might be and a direction? And then how do we actually define how we're going to act together? And then what next, right? What next? How do we take this information today and apply it into our own teams? So that's what we're going to talk about. And we're going to back and forth a little bit. There's some slides, and then Dawn and I are going to have a discussion about some of the various teams and experiences that we've had so that we can try and get some learnings and then some practical points as well that you can take away. So that's our plan. So let's get on it. So here is the kind of the setup, and I probably don't need to tell you much of this because you are living this and feeling this, but and particularly in BC at the moment as well, with the various things and pressures that you have, particularly around money and resources. But we know that this is happening across the country in various ways. High expectations of care delivery, as well as this strain on resources. Now, this list here is not necessarily in any particular order, and I would suggest that it is all interdependent upon each other here. Retention and recruitment has become quite hot topics. We're just hearing again about the ER. It's important, and this sense of general frustration, we've been talking about this, and since COVID, there just seems to be this culture change that people have noticed, and it's kind of hard to put your finger on it a little bit, but it certainly has changed. One thing is that we see and hear quite a bit is we're just not getting together as much as we used to. A lot of stuff being done online. We're not doing it in person. We're not building this kind of community, this kind of culture as much as perhaps we would do. And we're also recognizing more poor behaviors are occurring. Now, is it more poor behaviors, or it's just that we're now less tolerant of them? You can argue, but certainly there is a lot going on, and a lot of this is dependent, right? We find things difficult, we get frustrated, and then poor behaviors start to drip forward. Now, some of this stuff you can't solve, right? You're an individual working wherever you are. You can't solve this, right? You can't make more money suddenly appear and so on. But within this, there is a lot that you can do. And I think that as an individual, it's possible to do certain things, but it is hard. But I think as a team, you've got a higher chance of resolving or dealing with some of this stuff. So here we have so there we are. So these are the challenges that you're facing. So what is a team? Let's get into that. And there's often quite a bit written around this. What is a team? So I think that each of us is probably a member of a variety of different teams. Some of them are very solid. For example, I work in a clinic. There is my clinic. Here is my staff. There is a team. I'm a part of a division of something. There we are. There's my division. That's kind of a team. And then there's these sort of transient teams that come in and out of being, perhaps like the operating room. Well, it's a team there and then, but the members of it may be changing, right? So there's sort of a solid and then maybe a bit of a flow. But the definition that we put in here sometimes, or rather simply here, is that I think that what we have seen in a lot of the teams that we get called to work with is people working like a group, which is where you work side by side and you have individual goals. So there is a bit of a loose connection, but your goals are individual. Well, a team is where we work together towards a shared purpose, which is creating some sort of value for a wider system or individuals or other teams or other groups. Because the whole purpose of having a team is that it's there to do something for somebody. That's why you've been created together, right? And so what we find is that this sort of concept of team in a lot of the work we do, just taking this definition as it is kind of wobbly. It's we haven't got that. We haven't got some of that shared purpose, and we're acting more like a group. Now, Dawn, I don't know if you want to add anything to that before I move on to the next bit here.
No, I think a team, another way of thinking about a team is you are interdependent on each other to do what you need to do. Versus, as
Yeah.
Tom was saying about a group, you're just, a group coming together, doing your own thing. And I think people may be on teams, but are functioning as a group.
And so this leads us nicely into really what we have noticed. And here are some of the key things that we have noticed before we sort of turn into, well, what can we do about this? So what have we noticed? Well, the first thing is we need to recognize we are in a team and to act in that way. And I think that a lot of the teams that we end up getting to work is we just haven't recognized that. Right, we're just not there with that. Dawn, and you want to comment on that?
Yeah, I think a lot of times, to me, it's interesting that physicians are actually socialized, I think, to be independent and autonomous, and are often socialized to be seen as independent contractors. And then they are expected to work on teams. And I think something gets lost here in terms of even the anesthesiology group is a team. It's not a group of individuals, but they function that way. But they're in and of themselves a team. I want to comment back, Tom was talking about COVID. I think part of what a team needs is social capital and relationships and knowing each other. And I think a lot of that has gone missing, that the social capital isn't there. And when we have social capital with each other, we feel we don't over personalize as much. We are much more forgiving of each other and overlook things. And a lot of that's lost. A lot of that is lost.
That's right. So recognizing we are in a team and who is our members is really the first step, that actually this is something that I have to think about. And I think that it's what we find is, or we've seen is that with this sort of groupthink, where we're not really recognizing is that people start being autonomous. We start moving towards self-interest a little bit more. And particularly when we are unhappy with, for whatever reason. So I've written here, when things get bad, whatever that means, there's lots of reasons. It can be resource, it can even be provincial, it can be the hospital, whatever. Is that when a team that is acting like a group starts to become dysfunctional in whatever reason, we start to look inward, and we lose our way. We begin to drift away from what really is important, and it becomes. Sorry, you were going to say about pecking?
Pecking. I think individuals start competing with each other. Who's got what? Start pecking at each other, become much more narrow in their vision of what it is they're doing, and don't see themselves reliant or accountable or interdependent on each other. It becomes every man, every person for themselves. And we really see, like, often when we start to work with a team, that whole mindset is a mindset that people haven't even thought about before, what it means to belong to a team.
And this is something that Dawn and I talk a lot about when we're talking about leadership and things generally, is one of the key things, and there are many causes of this. I'm not trying to oversimplify this too much, but is often due to a lack of clarity is what sends people kind of off. And what I mean by that is that it can be clarity of our our vision, our purpose, our roles within the team, lack of clarity of where we're going, lack of clarity on anything that we can do. Because what we do if we lack clarity is we try and fill in the gaps. We make stories up. It becomes gossip, it becomes this, it becomes that. And before you know it, it becomes a fact, even though it isn't. And so this concept of lack of clarity is a real driver.
Well, I think we can all remember, when we were kids and think about it as a classroom, when there was no rules, clarity in the classroom, it could quickly run amok. And I always say it can devolve into Lord of the Flies, where everybody's doing their own thing. So when there's no clarity, people start making it up, and they also feel unsafe and are really, again, back to this inward looking and trying to protect themselves.
And this is where it comes to, right? Team leadership does matter, right? I think that medical leadership is not well trained. As Dawn often says, the leaders of not that long ago, it was to, maybe put the schedule up, do the Christmas party, set up the golf games. That was kind of it. But now the 2025 and modern healthcare demands a lot more of that. And maybe teams are a little bit bigger. It's a lot more complex. There's a lot more going on. And so leadership does matter on this. And a great example is leadership around clarity. We're dealing with one at the moment where we have a leader who really isn't clear on a lot. And it has created all sorts of stuff going on, the stories that are running through this team. Nice person, great individual, but just has not had that clarity to deal with the certain things that have popped up.
Very conflict avoidant, very conflict avoidant, which again dysregulates everybody on the team.
Yep.
So they start making up the rules themselves. And what you start to find is people will start breaking off into small groups, and you've got, the group that they talk about this group talks about that group, and you get factions when there's that lack of clarity and someone who doesn't really want to take the helm. And on the other side, we also, if this is one end, you're going to see the opposite of the leader that's very autocratic. More the micromanager, the more, do as I say. There is no conversation. There is no sense of team or collective. I like that. This is called setting up camps. Yes, well put. Well put. It is setting up camps.
I should pause at this point. And are we hitting your teams yet in terms of things that you're seeing? I wonder, put in the chat if you are. But let's move into this other one, which is, it does matter. And not only is it the clarity of the here and now and what we need to do, but it's also a lack of a direction, of a future focus.
Yeah.
is something that's quite crucial. And again, in varying degrees, depending on where your teams are, but I think all do, because if we haven't got that direction, then, what are we doing? How are we basing our decisions? How are we, which, helps with that inward looking kind of approach.
Well, and that's something that Tom and I talk about with teams, especially if they're a dysfunctional team, this whole concept of future focus, because often the team comes with a history and with pecking at each other, etc. And that's one thing that you want to do in creating a team, is to say, okay, that was then, this is now, we are future focused, moving forward. We are going to be.
Which is hard and isn't easy, because people like to stick with the familiar and it's comfortable, but it can be done. And I think it also comes down to this, is that when things start to rattle on down this route, is that we basically lose our awareness of why we even exist and who we are serving. Now, I appreciate that might be a little bit of a triggering word for some people, who we serve, but let me just explain that. Any team that is created is doing something for something. We are serving something, right? We are doing something. There's an output, whatever you want to call it, for something. It's a service, right? And so I think, again, a team that I have in my mind at the moment, again, have gone down this route, and it's the one with the autocratic leader, and we just completely lost why we're here. Now, we're turning up, we're doing our day to day, patients are safe, it's fine, but we have lost completely this whole team concept of how we're moving. And there are some very real things that need to be done as a team, and we're fighting and we're arguing and we're just not getting to it, to the point where the organization is really losing patience with this because we have just become so inward looking.
Well, and they're also, what ends up happening, and like this whole concept of who are you serving, is they are impacting other teams.
Oh, yes.
Yeah. And so they're impacting the let's pretend it's anesthesiology, they're impacting surgery, they're impacting the surgical teams. All, it just, it's beyond camps.
Goes round and round. And
Yeah.
and I think we've also got to put this on that we've noticed more so now is this changing culture. Now, and there's lots of different ways of looking at this one. We've already touched upon a few of them, but the fact of the matter is that we seem to be organizations are getting really tired of this now.
Yeah.
We're getting more to the point now, particularly as this one where it infects others. And I think we're in 2025 now, and a lot of the stuff and nonsense that we've been tolerating shouldn't have been tolerating as long as it has done. Society has caught up. So we're now in this sort of little bit of a perfect storm whereby, we really got to get this stuff sorted out, because this whole concept is beginning to run away now. And here we are.
And we talked about scarcity of resources, and I think that's one of the reasons,
Yeah.
I don't know what you think, Tom, that it costs money. It costs money to work with individuals, but also when you have a dysfunctional team, a lot of money can go into like the impacts that it's having, loss of money, and to support the team.
So there we have it, really. I mean, there are some very real reasons and, stuff that we can't do anything about that are going on that are influencing. But then there's also a lot of internal us as members of teams who are doing things. So how do we move this forward? So, okay. If we were to think about if this team, your team, could be wildly successful in 1 year, what would it have done? And I don't mean outwards, I mean also inwards. That's where we have to get to. So let's think about the steps. And we're going to go through sort of 3 steps around, if you like, the foundation part of team building. So let's start with this one. This is the commission. So this is really where you are clear as to what your marching orders are. So let me explain a little bit. I appreciate that on the call here, we have people in all sorts of different environments. Some of you are parts of organizations. If you're a part of an organization, you are part of an organization. You are part of something bigger. There will be lots of strain on various resources, various things. Your organization will have various goals and things that it needs to do, right? Strategic plans, so on. So what is your team's role within that organization? Now, a lot of us would just defer and say, well, it's to look after patients. Yeah, fine. Yeah, of course it is. Absolutely. That's our core being, I'm sure. But equally, what else? What needs to be built? How does it affect other teams? What is the resource that's available, and so on? So what are the marching orders here? And I'll give you an example, which is, so I was involved in a steering committee, actually. This was a team on that one. And it involved 5 organizations. And so this steering committee was basically lost right from the get-go. It did not know what it was doing. What we did is we got the 5 CEOs sat in the room with us for an hour. We asked questions, and the CEOs were very clear as to what their expectations were, because there's 5 of them. That added some confusion, but actually it wasn't. They were very aligned. They gave a very clear idea of what the expectations were for this team, what the marching orders were. So they said, this is what we want. We interpreted it and said, okay, we're now clear. This is what the commission is. And so this is something that we do not infrequently, is with the teams that are struggling, is who is the boss above? They need to say, this is my expectation of you in terms of the commission. So If you are unsure of your commission, you either ask, well, not either, you ask, what is it?
Well, and it's interesting that often when you ask that question, most people above actually have a clear commission. They have a clear idea. And I think that's really important. And one of the things that Tom and I do when working with teams is get the leader to make sure they're clear, because that actually becomes a bit of a North Star. Like it starts there. And often what we'll do is bring that individual or those individuals into the team to remind people of what their commission is.
I'll give another example, actually, a recent one, which might be interesting, is that, so I was working with, it's a smallish hospital. There was about 8, 9 kind of division leads and a chief medical officer. And the place is a little bit of a mess for various reasons and behaviors and so on. It's a small place, but they're having trouble in recruiting and just general culture. And it's well known within the area. They don't like the fact that they have a bad reputation, but they do. And so we were doing some leadership development and saying, okay, well, what is this? This is a leadership team here. How do we build this? And it took the CEO coming in and discussing with them what they are seeing that they want for the goals for this, what they're seeing are the issues. And it took that for this group to realize, actually, our commission here is we've really got to turn the culture around, because lots of reasons it's the right thing to do, but equally retention and recruitment is actually seriously an issue. All the things we're grumbling about, we actually have a little bit of agency on. If we as a leadership team can start to think in this way, and then we can convert that down into our teams, then maybe we can make a bit of progress on this. And this was like a big aha moment of, okay, that's our commission. That is why we're spending 2 days together. We got to figure this out. So there we are. So commission is an interesting concept. So that's the first one, is being clear on what that is. So now let's go to the second one here. And this is the team purpose. Now, here are 2 questions that are good to ask, which is, what can this team of people uniquely do that is required in your area, whatever that looks like, province, town, whatever, for the future? So that's really clear here, is this team, whatever the context is, wherever you are, is unique. You've got unique people, you're in a unique area, you've been given your marching orders. So what can you do with that is required in this area, and also future thinking? So in other words, or putting it another additional question, what can we do as a team that we cannot do apart? That's the question we have to get to with our purpose. And it is this recognition that we are part of something bigger, right? Because the team is part of other things, right? And I'm going to prove this to you in just a second. We're going to get you to do a little exercise, which is something that we do with teams to think about what is our purpose, what is our why here. And so we'll do this quite quickly, if you like, if you've got a piece of paper to hand and a pen, is to ask yourselves, who do we serve? I'm asking that question again. Who are we in service to? So what you would do is draw your team, not you as an individual, your team in the middle of the piece of paper, and think, okay, so who are those? You spider diagram it out. Who are those groups, teams, individuals, organizations that we serve in the team and its output? Now, patients is obviously there. I get that. Families, yes. But who else? Maybe it's nursing staff. Maybe it's laboratory staff. Maybe it's senior leadership. Maybe it's the organization. Right? Who are we serving? Right? We're doing this output. And if you keep going, and hopefully you're fiddling a little bit with this now, as you keep going, it starts to get quite big, right? You get this sort of spider's web. And we do it on these big pieces of paper and stick them on the wall. And it's like, well, what are you noticing? What do you see? Oh, it's quite a lot. We have quite a big kind of thing, right? And so it then becomes as well, yes, your actions, your output is going to have an effect. So how do we gather that up? And so here is how you can work out your purpose. So if you've done that little exercise, maybe just pick one of the groups here. And then you sort of ask yourself these questions. We serve the group that you've written down there. You put that down. We serve them. Okay. The second one, enable them to do what? So as we do our work and serve this particular group, what are you enabling them to do? Right? Because you are, right? There's something that you are making them to do. The second one, they are then able to serve whom? So by you doing this work for this group, they are able to serve whom? For which they create the benefit of. Now, if you can do that and you do that for a few of your groups, it starts to become a little clearer as to what this team's purpose is.
So what it looks like when we do it is often what we'll do, let's say you have 10 people on your team, is break them into 2s and 3s, put up a sheet of paper and let each of the groups go at it. Because between them all, they'll cover stuff off. And I just want to draw your attention to between the commission and starting to create this team purpose, this is where you're getting people from looking inward and seeing themselves as an independent to looking outward and starting to see themselves. You're shifting that mindset.
And what you're also doing is starting to create a team charter. This is part of the basis, which we'll come to in a minute. That's right. And I think it is important. We're shifting them out from this in-looking and all their issues to focusing on the fact that, no, actually, we are here to do this work and it is serving and it does have an impact, and us not doing this well or chatting around or whatever devalues it. It's quite interesting, actually. You can shift quite a lot of people into starting to think slightly differently about their team. It's not a magic wand, by the way. I mean, there's still a few that drag their feet, but you always get that. But it starts to just change the nature of the discussions and can also then start to serve as we're making decisions, as we're trying to think about what direction or spending or how many people we need or, whatever the discussions we're talking about. This can
these are like
serve a little bit of a foundation and a North Star.
I was just going to say, these are the foundational pieces. You're putting a foundation where there was none. There was none.
So this is your team white. So again, I'm just going to ask you to reflect on this as you're thinking about your team or teams, because I suspect you're members of many different. How would a commission, thinking about what the commission is, that clarity, and then thinking about getting that team's purpose together, how could that be helpful to you? So just think about that. This is work that can be done. So just reflect on that as we work through. And again, please, if you have any questions, please ask as we go along. Any points of clarity. So then we get into the third part here. We know what we've been asked to do. We've been given our marching orders. We've got some clarity now on our purpose. We've started to understand what our why is. Okay, so how are we now, this team, going to work together to do whatever it is that we need to do, which we also need to define, but we'll come to that in a minute. And so this is where we get to. What do we as a team to work together to meet our purpose and goal? What do we need to do? And there are a number of different elements to this. And part of this is going to be the series that we're going to do in it's going to be 2026. I can't believe I said that, but I did. We're going to have to go through some of these in more detail. But let's start with this here. Most of the time in healthcare, we throw people together as a team and get on with it. As I've said already, the things that we've just been speaking about are proactive ways to set down a foundation, even if you're not bought into this. This is, well, we put ourselves together. How are we actually going to function together? So here are some questions. How are we actually going to deal with disagreement? Which is a really interesting question. Have we even had that discussion? Because we're not always going to agree, and that is fine. Respectful, and I emphasize that word, disagreement is actually really, really healthy and should be part of the team. But we need a mechanism or ways of thinking about it so that it becomes a healthy way. Don't we? This is stuff that we have to tackle all the time in almost every team.
Yeah, well, and it's really interesting because when you shift to this part and it always works out the same. You put up the sheets of paper, you get people to put down what they want to see and what they don't want to see, what helps, what hinders. And it's amazing how suddenly they're on the same page and collectively saying a lot of the same things. We don't want to see gossiping. We don't want to be talking over each other. We don't want to be, which is all like they're collectively, you're getting buy-in, you're shifting mindset. But it's fascinating, I think, Tom, how they're doing the work, but how much they're also like rowing, like everybody wants the same thing.
Yeah.
Like,
Yeah, there's different, some people have some very different ways of expressing that in actual ways, but we'll get to that. That's still recognizing. But by calling it out, by talking about it, by setting it down, by creating this charter, it's being open by it, it's being explicit by it. And sometimes it's new to people. They're hearing this and going, huh, that's interesting. I mean, we did one exercise where we said to each of the individuals is, what do you value most about this team? Now, this is a team that there's factions, there's stuff going on. And it was really interesting because every single one of them was like, yeah, no, I value my team members. I value the fact they're there. And yet this is, they're fighting. And, there was tears and all this. And it was this sort of recognition that, what, actually, we have a lot more similarity than we have apart. Okay, now we need to build on that, right?
well, and I also think too is, especially if things have been dysfunctional and going on a long time, it is a safe way for people to purge themselves and to put things up that they are fed up with, they don't want to see, without naming names, but all the things they don't want to see and all the things they do want to see.
Mm.
And it quickly starts to become aligned.
Now, one of the things that we pretty well consistently have seen in the teams is this second point, which is how will we have our discussions? And what is it, Dawn, that we don't see very often? Is good meetings or meetings. Now,
Yeah.
oh, I don't want another meeting. I hear everybody groaning. And this is going to be the next one. The next session thing is really to dig into this meetings thing, but just for the concept for the time being.
It's actually shocking. It's shocking to hear that that there aren't regular meetings to actually work through things. They don't see each other. And sometimes too, leadership is not actually meeting individually with the individual team members. So everybody's really disconnected. And it makes sense that they start turning toward each other to have side conversations, and it encourages, I'm going to use the word somebody said earlier, camp behavior. And one of the things too with this is we get teams to decide what their 2 or 3 core values are that represents. Now, obviously hospitals have codes of conduct and have values, but what is, again, this is about creating a team. Is there going to be 2 or 3 values that they're going to hold each other to, that are going to represent, that they are going to live?
Yeah, and it becomes then about the structure of what does a good meeting look like? So, we never have agendas. Well, you do now. And if we are going to raise, what are those things that the team or members of the team are unhappy about? Okay, well, we now have this forum, so let's create it in a way. Let's also, as Dawn has said, let's set out what are those norms and those behaviors, and how are we going to deal with disagreements. And then there are ways of doing that, and some models which we'll explore a little bit in the next one. So this whole concept of having well-structured, useful time well spent meetings. I'm going to say that because we all sat through many meetings that aren't, and we don't want to repeat that. But it's a commonality is that we're not meeting, or it's not a way of engaging the team. So going back to one of our other friends that we're dealing with, had a very autocratic approach, which was literally we're turning up to be told what's what. Now, sometimes there is things to be told, to get that,
Yeah.
but when it's everything, it was turning the group. So we have to do a bit of education around, well, how are we going to do this? And actually flipping this in terms of, well, look, here's the goal that we've been asked to look at. So how team are we going to do this? And then managing a good discussion around that so that we get buy-in. Now, it doesn't necessarily mean we're going to get agreement. Okay, well, what's the consensus view? Is that the voting? Fine, there you go. We live with it. And that's how we have to put those norms in, as opposed to having structureless, oh, let's just get together and have a conversation. We're not going to get anywhere, probably. Well, we might do, but can we tackle those things that actually as a team we really do need to do if we're going to reach the commission, the purpose, and the values that we have?
And again, I think the beauty is then individuals, would they become a team and they take ownership for this. This is not something that's being imposed upon them. They are co-creating this. This is
Absolutely.
their team. This is how they want it to function and how they want it to work. And we've never had anybody say, we don't want any meetings. We haven't had anybody say, well, we don't care about this stuff. More our experience is everybody's been waiting for somebody to create a forum and a place for these types of conversations, these types of guardrails to go into place for them.
So just again, I'm going to ask you, just reflect on your team or teams meetings. Are they useful? Are you getting clarity? Is it a venue whereby you can talk and resolve whatever issues might be vexing the group in a way that is civil and reasonable? Accepting the fact that, this isn't rainbows and unicorns. You're not always going to agree on everything, but can you do that? Do you feel safe to do that? If the answer is no, then we need to look at that, right? That's something that's fundamentally important for a good function.
Well, and I think too with the team meetings, it's creating a space to hold those conversations that need to be held. Like now there's a forum rather than outside, it's in the team where there are expected ways of behaving that each other are going to hold each other to be account. But now we can have the conversations around what is working for this team, what is not working, as opposed to having side conversations.
And I think once we've started that, it moves to this other one here, which is then forming some specific goals around, okay, internally. So let's say, this time of year, it's great to say, okay, so 2026, what are we internally going to do? And it could be our goal is to have really good meetings so that we can have non-conflicting and reasonable discussions. Okay, there's an internal goal. So let's work to that. And equally externally, so thinking about those partners that we've identified on that exercise in the last one, are there any partners here that we need to develop for us to meet our commission and our purpose and to fulfill? Are there partnerships here that we need to work on? We need to have better relationships with. Are there some that we're spending too much time on, right? Because there's not so much time in the world. Maybe we need to shift our energies in a different way, whatever that means and looks like for your particular team. So here is, once we've got that foundation, we can start having these useful conversations which give direction and purpose and meaning and can help steer and steady the ship. Now, some people would be saying, well, not everyone's going to come along and all the rest of it. We're going to address that in just a minute. Okay, so I'm going to show you this. This was some work that Google did, and some of you may be familiar with this, the Aristotle Project. So Google asked itself, what is the perfect team? How can we create the perfect team? And I think we might, I don't think anyone was too surprised with the results, but I think that there is also this view that if we get a team of highly qualified expert people together, then we will have the best team. And I think there are plenty of sporting analogies that would suggest otherwise. England football team, for one. And equally, we've heard, the Blue Jays being an example, and this is where I'm getting out of my depth now in the sports zone for North American sports, but sort of, maybe not all great players, yet as a collective, they have achieved what they've achieved. And what the Aristotle Project showed through all of its data and looking is that it's not actually so much about the expertise and skill. Of course, you have to have a baseline and understand, if you're in medicine, I get that, but it's not about being the best. It's not about being, the greatest. It's about actually creating psychological safety. That is where you're going to get the best team. And that's the first one. And we're going to do a specific one on that in the series. It's then secondly, dependability, is that people are going to do what they say they're going to do, and you can depend on them, and you can depend on me, and we can all depend. That's the second one. So remember what we were saying about all that infighting and inward looking? Well, if we've got something going outward that we're all kind of going towards, we got a better chance of creating that. We have structure and clarity. Well, that's come up a few times. Well, number one, we are being proactive, thinking about what are those structures, the commission, the purpose, how we're going to structure our meetings and teams. And I don't want that to sound too rigid and boring and just so that, it stifles creativity. I don't think that's what we're saying at all. But by having some structure, it allows people to know what's coming along and provides that clarity, because it's the clarity or the lack of clarity that sends people off making stories. And
nobody does well when they feel unsafe, and that structure and clarity is really important. Also, under structure and clarity, what they found is that included roles and responsibilities. And roles and responsibilities, often, again, we don't have explicit conversations about that. Sometimes they blend over, but it's the number one, especially in healthcare, for conflict, is who does what, when.
Oh, yeah.
Yeah.
And then so we get the last two, which, meaning and impact. So that people feel that the work that they do has personal meaning and it has impact. And I'm not trying to generalize too much here, but from what I've read is that that's actually a bit of a generational thing beginning to come up, right? Your Gen Z are much more around this. And if they don't feel that, they will walk, right? So as we think about the future, as we think about recruitment, retention, and things like that, it's not that we don't in medicine have meaning and impact, because we kind of do. It's just that maybe we don't talk about it. Maybe sometimes other people within our circle, within our team, are not feeling it. We're not talking about it. We're not celebrating it. We're not, thinking about it in different ways. Is there opportunity there that by building that, we help keep people within the team in a way that it's an enjoyable and meets them? So I sort of challenge you to think about that a little bit. I mean, some of you will be rolling your eyes, and I suspect that's a generational thing, right, as well. So, but think about it, because this is what the evidence that Google came out with was saying, and our guts would tell you that's got to be about right. If you think about any team that you've actually enjoyed being in, it's probably had a good chunk of that. If you think about the teams that you've hated or didn't like, it probably didn't have a chunk of this. So inherently, this feels innate, really, right? But we don't proactively set this stuff up. We just kind of let it happen. We think about it. Well, no, we have to be active. And that's really what we're saying with the commission, the purpose, and then thinking about how we're going to structure those team parts. So as we kind of draw in, and we're allowing a little bit of time, and so get those questions in. We've got a couple that we can deal with, but please ask away. I think that here is kind of the summary parts, and I think I might add a fourth one actually at the beginning of this. So number one, I think we want you to take away is that wherever, and thinking about your teams, and I appreciate there's lots of different teams here, is where can we be proactive in setting this up? And to do so rather than just letting it form, is where can we put some structure in? And I think it's understanding your commission. I think that's a really important one. I think establishing your purpose and then creating this charter. And even simply put, if the charter is, these are the behaviors as a group that we want to have, and these are the behaviors that we actually don't want to tolerate within our team, there's a start, right? We can go into details around, oh, this is how we create them. How do we want meetings to run? Even if it's start, stop, continue behaviors. This is what we want from a meeting. It's going to be online. Cameras are on. That's the rule, right? You know, whatever it is, we can set these things up.
And
And
because it's been co-created,
yeah, well, that's the point, right? It's not us. Or you, the leader, or you, the person who's facilitating it. It is a group thing. You get group buy-in, and it actually makes
yeah.
it really easy to hold people accountable for what they have created. It's not just
Or
come.
if they step out of line,
Yep.
the group agreed, this is how we're going to operate and function. If you're a member of this team, this is what it looks like.
So here is the series. We'll put this in, and then we'll hopefully, I don't know if there's anything coming through on the chat here. Oh, there's something there. So here is the series. So I'll just run through this quickly so we have a little bit of chatting time. So April the 20th, which seems like ages away, but it won't be. It'll come really quick. We'll talk about that meeting part. How do we make good meetings? Um, what they look like, and that's something that you will be able to take away and you can start applying for those. Psychological safety, we've already said that's an important one. So how are we going to do that? How do we set that up? What are some tips and tricks? Civility, conflict, and culture. Oh, that's a bumpy one, but it's important because good conflict. And then how do we get respectful? How does that come into the culture of what we want to see? And then finally, feedback, which is probably the one that you may find interesting there, which is how do we have good discussions where we go back and forth and you know what, we point things out, you know what, that's normal, right? That's part of growth. We should be doing this because we are all still growing, we're all still learning. We will misstep or we will do good stuff. How do we know? And unless our team is keeping us going with this, then how do we know? So we'll talk about that and how we can set that up in a good way. So that's the fun stuff that is digging in a little bit more into, I guess, the charter and that piece. So here's some questions for you here. And then we'll put a Slido up and you can add some comments in if you wish, or put them in the chat, whatever you prefer. So thinking about your team here, what have you heard? What have you heard about today that your team needs, that you are curious about? If you're a leader, what do you think you need to do next? Right? There's some questions for you to think about. I'm going to put the Slido up, and so the question here is, what is one thing you are taking away that you could apply to your teams? And that this works by getting your phone, put your camera on, put it over the QR code, and then you can type in. So it'd be great. I don't know how many people we've got there, so have some comments there. While that's coming through, we can take on a couple of, was there any questions in the chat? I haven't seen. No? If not, I've got a question taken from a few of that.
There's one question on the Q&A.
Yeah.
It's asking, what if not everyone agrees to the charter?
There we have it. And I had the very same question because it came up a couple of times, which is, what if I can't get someone to come along with this, right? What if that's where we get to? So, Dawn, how are we going to tackle that one? You're on mute there, Dawn.
Sorry. There is something to be said about group pressure. We've actually never had somebody who within the group has said that they disagree. I mean, it's really difficult to disagree with being respectful to each other. It's difficult.
Yeah, pretty hard.
Now, I mean, living it is a different story, but for the most part, when we've done this, people will agree on similar behaviors and that they are going to agree to them. It's a different story about having people follow them, but I think you then have the guardrails and it's collectively the group holding, like now it's not just the leader, but the group collectively holding the other individual. We've agreed that we are going to talk civilly to each other. We agree we're not going to interrupt each other. We agree that we're not going to, and if there's a lot of gossiping, giving people some skill building around how do you redirect some of this behavior and shut it down and not contribute to it with others. Tom, do you?
Yeah, I'd agree. I think that it's an interesting question, and you're right. We haven't had that, and the way that we would do this is we would do it in small groups, so people create. For example, what are the behaviors that you would like to see? So everybody writes stuff down, right? We pull that
Yeah.
together. What don't you like? Well, we put that down. Okay, it's there in the charter. And then you put it out there and you say to everyone, is there anything that you want to change or add to this? Because this is your work, it's done. And no one's going to turn around and say, well, actually, I want to take out respectful behavior or, speaking nicely to people, right? No one's ever going to do that, it seems. So to be honest, you're kind of there, you've got it, you sent it out, there's no other comments. There it is. It's now in play, right? Now, what then happens, as Dawn says, is the ones that then follow actually then live it. And that becomes then a sort of performance management issue, which we can talk about a little bit more when we get into the civility thing, but it's an interesting one. No,
Well,
it's
and we have a team right now where that is happening. And I think the beauty of it, it's becoming clear who the outlier is. And so it is going to have to be managed. But it is also collective pressure around, I think the team, shouldn't say group, the team feels much more empowered to hold that individual accountable and are much more self-reflective about how they're contributing. I think
we got a comment here that we have a group agreement, but there is one person who constantly goes back on our consensus. So we continue to work on group vision and holding that person accountable to what we as a team has decided. Absolutely. Are you in the team or are you not?
Yeah.
So I'm just scrolling here, and there's some great comments here in terms of what people are taking away. I did see a question, I think, pop up there.
Yes. The next question is, what do you do when people aren't following? Not because they don't want to, but because there are some personality issues, disorders. Others do not understand or don't know how to deal with these personality disorders.
Well, it's sometimes what we do, like, and that's a real example, is sometimes either Tom or myself will do individual work with the individual and act as a bridge with the team as well. And in terms of how to help this individual, because sometimes we've had to work with people who have some struggles and they do need skill building. So we work with that. Tom, do you have anything to add to that?
It's difficult, and if you're coming at this from the leader perspective, then there is obviously a different when it's a colleague, that's really hard, isn't it? And it is about ultimately it's the leader starting to take and say, well, hold a second, we've set down these norms, you're stepping over them. Now, what can you do? Now, if they truly have a personality disorder, I don't know. There's other issues, I'm sure, that we can deal with, but it's then making them aware. And then ultimately, if somebody is not in your team, then they're not in your team. And I think we've got to get to that point now where it's like, we've got our commission, we've got our purpose. This is what we want to do. Are you with us or not? Right. And there are mechanisms. And I'm not suggesting we should get rid of people, but ultimately people are making their choice. That's the point. They are choosing.
Well, exactly. And it's holding the conversation with somebody too for the leader to hold. How can these are the team norms. We've agreed to these. How can we help you? How can we support you? And we had one team where it was interesting and it was somebody that I'm just going to broadly say was slightly on the spectrum, didn't have a lot of situational awareness. And the way they held their team meetings changed, meaning an agenda. They said, I need the items ahead of time. I need to be able to digest and process. And I need some clarity around what we're like. So this individual could prepare to actually take part more constructively in team meetings. So.
All right. So I see that we're at time here, Walter. Is that right? I think we are.
We are at time. So there's one more question. Would you like
Oh,
to
yeah,
take
go.
that? Or
Let's go for it.
yeah.
And what I'll say is, if people have to go because that's the time, then
Mhm.
look, I thank you. But if you want to stay on just for a few minutes here, and we'll deal with this question. And hopefully you got those dates as well. What we'll be sending out to you for the follow-ups. Okay, if you want to go for the question, Walter, let's go for it.
Yeah. What if a member doesn't view themselves as part of the team or want to be part of the team? They just view themselves as hired to do their own work and that's it.
Yeah, so there's a number of ways on this one. So let's think about this proactively and then reactively. So again, I think proactively is that if you've set this up, anyone who comes into the team, proactively, this is the deal. This is how we operate, and this is what we are, and we want you to be part of. So proactively, there's something there, right? But of course, best will in the world, we then get to reactive. Okay, well, it comes down to, again, I think saying these are the norms and then holding people accountable for behaviors that are outside. And then ultimately, it comes down to, are you part of the team or not? Are you going to
Yeah.
function within this team or not? And
And they have choice, right?
it's
They
their
have
choice.
choice.
Yeah.
And what some people are starting to do, like with new hires, etc., once this collective and the charter is there and the purpose is there and the norms are there and there's clarity around it, is when bringing people in, that's part of the orientation. This is our team. These are our values. This is, so you have that in place. It's a little more challenging when the team's dysfunctional and you're starting from zero. And there is that individual, and it does sometimes, as Tom's saying, it goes back to the leader, but at least the guardrails are there and around how you're going to decide how to manage it. But
I think something we haven't mentioned that we were talking about earlier today, actually, Dawn, is that by putting the charter in place, what it sometimes does is actually highlights more where these behaviors are, right? Where before it was a bit of a soup of kind of, I don't know, whatever's, and you know, it makes it really clear. And we've had this before where, you know, it's been messy. We put the charter in and now they've stepped over, and it's really easy now to have those conversations and to deal with it and say, come on, this is not on. But there has to be consequence eventually, right? You can't just keep having
yeah,
conversations. And in most places, this exists to be able to deal with that, right? It's just
well,
hard. We don't like it.
well, and I think too, I mean, there's a little kid in all of us, and when you put the charter and you put the purpose and everything's down, you are going to get some testing from some people to see whether this is for real or not. So that's where the team and the team leader need to be prepared to say, no, we agreed, and call people on stuff like in the moment and when it happens. And I do think, and that's what I was saying, that it's interesting because what we have found in a few situations is it does kind of highlight the outliers, which then become, and it can empower the leader, the team leader now has actually, can be more proactive about that coffee cup conversation or how they escalate things. But at the end of the day, excuse me, you know, this is our team, this is what we've decided, and you can decide to be part of it or not part of it, and what that looks like.
Yep.
But if you're going to be part of it, we're telling you this is what it's going to look like. I've often, oh,
No, go ahead.
I was just going to say, I've often working with individuals that sometimes are not happy with the regulatory body. They don't want to follow certain rules. And it's like, I'm not saying the rule's good or I'm not saying it's bad, but at the end of the day, you join this club. These are the rules.
Yep.
You're either in or you're out. This is
Same with
this club
organization.
rules.
Yeah. All right. Anything else there, Walter? We're happy to.
I think there's a question asking how they could hire your services. Do you mind leaving your contact info in the chat, Tom and Don, while I wrap up the session?
Yep, I will put my email address in here now.
Perfect.
And
So while you're doing
you
that,
either of us, and we will, yeah.
Yeah, while you're doing that, I just want to wrap up the webinar. Thank you, Tom, Don, and everyone for attending tonight. If you have further questions or comments, you can send them to Physician Business Services or complete the survey. The recording will be posted on Business Corner next week. I'll now paste the links to our final 2 webinars before the year end in the chat. They're both CME accredited, so feel free to register. The first one, December 2nd, a session with Switch BC discussing managing workplace risks and the CPHS program they offer. And on December 3rd, a session with Dr. Jenna Evans and Dr. Paul Hertz on billing audits and common pitfalls. They can be found under upcoming events on Doctors of BC website. Also saw a comment earlier in the evening about having more interactivity within the webinar. So I guess I'll take this offline for Tom and Don and see if we want to do any more interactive breakout rooms or discussion group for the next 4 sessions. So
Sure.
thank you everyone and have a good night and see you at
Take
our
care,
next
everybody.
event.
Appreciate your time.
And thanks.
Bye-bye.
See you next year.
That's right.